Welcome back to Left Unattended. I'm your host, Ron Sosa. Today's guest is someone I have been genuinely excited to bring on to the podcast because this conversation sits right at the intersection of so many things that matter deeply to me right now, which is neurodivergence, identity, inclusion, communication, and the systems that quietly teach people that they are the problem when in reality, the system is what needs disrupting. My guest is Dr. Jody Wilson. Jody is an autism researcher at La Trobe University, an author, speaker, and what I would call a dedicated, disruptive influence in the very best sense of the phrase. She brings together lived experience of autism, ADHD, and acquired physical disability with an award-winning career in veterinary medicine, a master's degree in positive psychology, and an unwavering commitment to challenging systems that were never built with neurodivergent people in mind. In this episode, we talk about what it means to be labeled the problem in the workplace, the trauma of chronically masking and the difference between burnout and autistic burnout, the hidden communication gaps between neurodivergent and neurotypical people, and why curiosity is one of the most powerful tools that we have for inclusion. This conversation is smart, honest, validating, and at times really personal. And if you have ever really felt like you were too much or not enough or constantly trying to translate yourself just to survive in a system that doesn't quite fit, I think this one's going to stay with you. Here's my conversation with Dr. Jody. I can't wait to introduce you to my next guest, and that is Dr. Jody Wilson. And before we really introduce you, because we often lead with credentials and research and accomplishments, but if we zoomed out from titles for a moment, what problem in the world are you actually trying to disrupt since you are known as the disrupt vet?
I'm trying to disrupt the systems that are barriers for inclusion, and particularly for neuro-inclusion. I have a very personal stake in that game, but really, given my outsized autistic sense of justice, I need to disrupt anything that's just not fair.
Yes. So when did you kind of realize or first realize the disruption wasn't something you needed to suppress and it was something that you needed to really harness?
So I did a master's in applied positive psychology, and I was formally identified as autistic and ADHD at around that same time. And we were talking about positive business practices, and one of the lecturers redefined disruption for us as modifying a system that's not working to be better. And I think the veterinary sector is full of systems that can be improved for both ease of being human and specifically for ease of being a neurodivergent human. And we have some preliminary data from all around the world that tells us that the veterinary sector is filled with neurodivergent people at least twice the rate of general population.
Yeah, I think, what was it, the 2024 study out of the UK? I'm going to butcher the name of this, the
Royal College of Veterinary Scientists or Surgeons. Yeah.
Yeah, they had it's a great first step towards some of that. I think it was 29.8% of the veterinary population that took the survey identified themselves as neurodivergent, which to me was huge. Yeah. We always did a speculation, but now we have the start of something real to tell us that this is true. Yeah. Our gut was right.
And I'm a data nerd. I love data, or data, as you guys might say.
Data.
Okay, cool. Data. So I was really excited by that too. And we started some preliminary polling in Australia through the Veterinary Kaleidoscope, which is our peak diversity, equity and inclusion body for the veterinary sector. And our initial polling is sitting around 40% neurodivergence. So, which I think is probably accurate. And I have a strong suspicion from spending quite a lot of time as an emergency and critical care vet that in emergency and possibly specialty practice, we might be sitting at around 70% neurodivergent.
Wow. I've always kind of made some assumptions around, the fact that inside the practices, it is female dominated, and females, at least in the US, I can't speak for other countries, is that they're still underdiagnosed or misdiagnosed with an anxiety or depressive disorder. Yeah. And so when you looked at that same study, I think it was over 80% said they had an anxiety or depressive disorder. Yeah. And I can't remember the ratio of male to female, but that to me tells me that there's probably misdiagnosis rates creeping up in there. And I was conservatively saying 30 to 50%, but 70% sort of blows my mind a little bit.
Yeah, look, when you're aware of what you're looking for and you stand on the hospital floor in an emergency practice, it's very, very easy to do a peer review of the room and make a whole heap of, I guess, educated guesses as to the traits of neurodivergence that you're seeing. And I think I'm probably being conservative with the 70%.
I don't doubt it. It's like hearing it shocks me, and it shouldn't anymore. I am one who has stayed far away from emergency medicine. Like, I am not, at least in the workplace, an adrenaline junkie at all. Like, I will do it, I will slow down, I will be calm, and I will hate every moment of it afterwards. Like, oh, I hate that. I went in specialty and I did dermatology. It was like the most non-emergent thing that you could do.
Although I have had my fair share of emergency itchy dogs. So it's usually an emergency because the owner can't sleep more than anything else.
Yeah, the client perceived emergency. Yeah. Like, I think that what they say, there's 2 or 3 actual derm emergencies, but that's a whole
nother podcast, right?
Totally. One of the things I want to do is kind of normalize the conversations and the struggles around, what we go through as neurodivergent people in the workplace. And one of the things that you touched on in the survey that I put out there was about being the problem in your career. And you tell me, like, what was that like, being the problem? What did that mean to you?
I think this is an all too familiar story for neurodivergent team members in any veterinary setting, is that we're traumatized into thinking that we're the problem, that we're too much or we're not enough, that we show too much emotion or not enough emotion, that we need all the attention or we shy away from social situations. And all of those things, including the things that are opposite ends of a spectrum of behaviour, I've been told I was the problem because of during the early part of my career. And I guess the idea that a person can be a problem for asking too many questions and asking not enough questions doesn't make logical sense. So I think that's where the trauma comes, especially for autistic brains that need logic to float. And given that many neurodivergent people are very direct communicators, there's more trauma around that when you're told, oh, if you don't know, just ask. And then when you ask, you're told that you're making people uncomfortable because you're asking too many questions. So all of those experiences, I guess, as a relatively recent grad, drove me out of working for somebody else. And I started my own practice 6 years after I graduated and ran that practice for, just over a decade. Loved it, got to do things the way I wanted, got to explain to people what I wanted them to understand. And that was a really good experience until I just burnt out. And as I understand it now, it was autistic burnout. It wasn't compassion fatigue or veterinary burnout, but I just couldn't people anymore. So I actually sold my practice and went and got a job stacking shelves in a supermarket during the middle of the night. And I did that for a whole year.
Oh, wow.
And if anybody who has a brain like mine ever needs a working holiday, it was so good. It was like my chaos gremlin got to come out and play because there were boxes to tear up. And also my lovely ordered autistic brain got to line things up beautifully on a shelf. So it was like, I got to wear my headphones because the store was closed. It was a really nice break. And it wasn't feasible long term. And after that, I went into emergency practice because I discovered that I was a night owl and I liked getting up in the middle of the night. And I actually did my best work in the middle of the night. And that's not uncommon for neurodivergent people. We often have really delayed sleep-wake cycles, and there's good data about that. And what I discovered from that experience was that if I stop trying to comply, if I stop trying to be who I would think other people want me to be, I'm much better at all the things I do. And so the idea that I was the problem isn't true, and it's not true for any of the neurodivergent people who are listening. I want you to know you are not the problem. The systems that exclude us and ask us to act in inauthentic ways are the problem.
Oh, this is like music to my ears. I have now built my coaching practice upon, well, I say unmasking in a strategic way because it's not always safe to unmask or to be the authentic self. So you've got to really determine what is safe for you to do and what not to do. But I still think that there's power choosing to mask versus that is the default mode. I find that there's a very distinct type of burnout from like identity erosion and the masking that is vastly different, to your point of, the compassion fatigue and what we go through in the practices. It's like, and when you start to look at all of the adversity that a neurodivergent person takes on in practice, like I feel like our resilience bands are actually probably a lot wider than the non-neurodivergent folks, because of all the adversity that we take in, all of the chronic cognitive load that we're taking on just by masking, and on top of that, taking on the compassion fatigue and the clients and the team and all of the things.
Yeah,
So,
that's so true.
you're just like singing to the choir to me. Oh man, I could just go on a soapbox about masking all day long.
And me
'cause
too.
it's
And
just
once again, I
insidious.
agree that sometimes it's not safe, and masking and unmasking needs to be something that we've both, given our assessment of the environment, most of us are trained very early on that there is no safe place to unmask, and learning how to recognize that you can do that and when you can do that is a whole skill set. And we often need to be taught how to do that. And finding a therapist who's a neurodivergence affirming therapist, and especially if they have lived experience of neurodivergence themselves, can be so incredibly helpful to learn what's actually you, what's the mask, and how do I assess whether it's safe to take that mask off even a little in the context that I'm currently operating in.
Yeah, all of my, let me just make sure I say that right. I try to be really careful with like absolute statements, but I can actually successfully say that all of my clients that I've worked with thus far have had a therapist along with the coaching that I've been doing and working them through that unmasking journey
Yeah.
for a particular goal.
Yeah, because it's
Yeah.
hard. It's
So
not
true.
something, I guess, if we think about it in terms of, the science of behaviour, we've been conditioned into a state of learned helplessness that says it's never safe to be yourself. And we know from the animal studies about learned helplessness that it's very difficult to retrain, to overcome that. And animals need support to do it, and people need support to do it. And that support can be absolutely life-changing and life-saving.
Yeah. I think about it from an animal perspective. When you've got the like really fearful Chihuahua, right? Who's like, they never really get 100% friendly, but we can get them like through positive reinforcement. We can get them to a degree of friendliness. Like we just never, I don't know, like, do we ever truly know where the mask like actually divides and the person is, there's always that underlying of like, is this me or is this mask? Because we've been trained to question ourselves over and over again.
Absolutely. And it's an impossible question to answer sometimes. I think, though, coming to that understanding that it is sometimes an impossible question to ask, and that's okay, is a really important step towards self-acceptance. We know that self-acceptance precedes self-compassion, and self-compassion is essential to thriving in the world.
I love that. So I think there's always a moment for many of us, myself included, where we realize that we've been sort of gaslighting ourselves into humaning correctly. What do you think that realization for you looked like?
It was a process of small in understanding until one day that final piece sort of clicked into place and allowed me to understand that authentically me was less traumatic than trying to be all the things to all the people. And I think it happened during an emergency consultation when I was still in veterinary practice. And a client came in with dog in congestive heart failure that wasn't oxygenating well. And so we whipped it out the back, got oxygen therapy. I came back to talk to the owner, and I had my proudly neurodivergent badge on. I had blue hair. I had tattoos on display. All the things that are considered unprofessional in so many contexts. That's a whole other conversation too. I am a professional because I have a professional degree. That's the end of it. How I look is nothing to do with that. But
Yes.
I think that the idea that I could do my job better as my authentic self was cemented that night, because the owner was really nervous, and I explained to him what was going on and explained to him that we could try a rescue, but we were never going to fix this problem. And he was like, can I call my wife? And I'm like, yes, because that's a really common thing after hours, right? Somebody races the animal in and the rest of the family catches up when they can. And he rang his wife and he said, I think you should come down. And I could only hear one side of the conversation, but it clicked for me when I heard him say, it's okay. The vet will understand she's autistic and she has blue hair. His wife was autistic. She was afraid to come in because she wasn't sure that her emotional regulation would be acceptable if they got bad news about the dog. And so understanding that I could be authentically myself and that could help me do a better job with patients and clients was the moment that I decided that maybe my ongoing non-compliance was for a reason and I could be deliberately non-compliant with those sociocultural norms that told me I was doing things wrong.
That paints such a picture. And I can remember times in the exam room, like I struggled for a long time with justice sensitivity and like that naive young veterinary professional where I think everybody needed to adhere to what the gold standard was. Like it was like, and then I got on that soapbox, like everybody needs to like, you shouldn't have a dog or you shouldn't have a pet or that was my justice sensitivity early on in my career. But now it is shifted over. Instead of the medicine, like that justice has really shifted to the client as I've gotten older and mature, really understand myself. And now I'm such a huge advocate on the client side rather than the hospital side. When that means you're not talking to the client good enough.
Right.
Like you're not speaking their language. You're not like, what are we doing to help them understand? Or maybe we just need to be okay with their world that they don't want to do X, Y, Z. That was such a shift for me.
Yeah.
To go from championing the medicine to championing the family of the pet.
Yeah, absolutely. I think I've seen the same thing in myself across sort of a career that's nearly 30 years now, is that my rigidity of thought around gold standard being the best option changed when I had my own practice and I got to know my clients a little bit more. And so I often knew what was going on in the background that was contributing to the decisions that they were making. And so I think when I went into emergency, even though in emergency and critical care gold standard is our aim, we were practicing contextualised care from the very moment we stepped through that door. And one of the things that we tried to do in terms of modifying approach to be more inclusive was to remind people that we can replace judgment with curiosity and that often curiosity can lead us to understanding, and that will allow us to help make a treatment plan for the patient that also serves the family and me as the veterinarian, because it's really important that I don't have vicarious trauma from the situations where people are being traumatised by my need to do more and their inability to do more. So I think curiosity over judgment is actually, in an exam room, is an act of radical self-compassion.
I'm going to jump tracks here for a moment and make some parallels because I had a client, wonderful client, and like she was just like, I'm burnt out. I want to leave the field. And when I think I asked her, like, what is your role as a veterinarian? Because to me, it's fascinating. I had romanticized the stories that I thought were going to happen. Like, oh, like my pet died and I really wanted to make sure no pet suffered the same way or what, like, anyway, what I realized is like that mask has been, my parents told me I should be a vet. And so therefore I went and been a vet. And so it's like the insidiousness of the mask is beyond. But I remember asking her, like, what is your role as a veterinarian? And it was like, it struck both of us pretty hard when she's like, my role as a veterinarian is to treat and prevent all suffering. And immediately as she said it, it was like, oh, that's what I think. And so now every time you walk into an exam room, you're setting yourself up for failure because one thing off that treatment list that you recommended is like, I didn't treat that suffering the way I thought it needed to be treated. And it was a complete reframe and like just changed your whole thought walking into an exam room.
Yeah, absolutely. And we often have these underlying stemmers that we're unaware of, that we don't know what is underneath our decision making and our thinking. And most of them for people who are neurodivergent and who are trying to comply with whatever socio-cultural expectation we're trying to comply with. Most of those, it comes from internalized ableism and we don't even know about it because we don't know that there's a different way to do it. And I think understanding that there's a different way to do it is probably that first step. And it's interesting, the whole, my parents told me I should be a vet, so I was. The reason I'm a vet is because my dad told me it was no job for a woman. Always did a little bit
So
oppositional.
it was in spite of.
So he's a vet and he was wrong. But anyway.
I do love that. I have played devil's advocate like almost my entire life. And that's why I really love and enjoy and now teach conflict resolution, because I don't know, there's just something about taking a stance that you don't even believe in to, I don't know if it was just dopamine seeking behavior, but to me, it was fascinating, like human psychology of like taking that on and really understanding and then hearing the side to defend it and then like getting into the embodiment of something I don't actually agree with. It's just so fascinating that my mind loved that puzzle of playing devil's advocate.
And that's it, right? It's a puzzle, it's play. It lets our brains just, I guess, experiment with ideas and examine them from all the different views. And that the understanding that comes from that means that even when we still don't agree with the position that we're advocating for as devil's advocate, we might understand it more. And that usually gives us more insight into how to come to a resolution, right?
Yeah. It's like I need to play and live in the experience to really capture it and then utilize it in such like various ways that I would never have like thought to connect dots on, that it just comes, I don't know, naturally because you've lived in this little experience.
Yeah. And I think that's actually one of the underrated benefits of learning how to mask hard. We can put ourselves in someone else's shoes and we can be curious about what that looks and feels like, because often we've spent, the first 20, 30, 40, 50 decades of our life doing that without knowing that's what we're doing. And once we realize that's what we're doing, the idea of walking a mile in someone else's shoes becomes suddenly much easier because we're aware that we can do it. And I think it's really important that when we're looking at conflicts within veterinary practices, that we remember there are two sides to the story and there's often bi-directional issues. It's not just one person, it's often going in multiple directions. And that's something that really was brought home to me during the coding of the data for a paper we recently published that was about autistic adults' experiences seeking support for mental health. And the idea that the double empathy problem spread further than we think. It's not simply we don't understand what empathy looks like from a neurotypical person, and a neurotypical person doesn't understand what empathy looks like from an autistic person. It was that we actually have different experiences of the world, including different experiences of the same interactions. But because of the bias that we have, that everybody experiences the world the same way that we do, we assume that other people are having the same experience if they're in the same room. And we know there's really good data to show that neurodivergent people experience the world differently from those with neuromajority style brains. And understanding that both of you can be right and both of you can be wrong at the same time is really freeing when it comes to solving problems.
You talk a lot about like the communication and like the societal constructs around communication and the stories that we're probably talking about in communication that are not explicit. So what does that give me some context around, like what you have noticed in the world as far as communication gaps?
So we tend to see two real styles of communication that are polar opposites. So one is low context communication, that's literal communication, that's explicit and direct. And the other is high context communication that includes subtext and includes things that need to be inferred from body language and tone. High context communication is the communication that neurodivergent people often struggle with because we're not set up to really take in this data the same way as somebody with a neuromajority style brain is. We don't have the same filters. We don't prune neurons. We don't have brains that automate things in the same way that neuromajority brains do. So everything that we do requires cognitive load, including reading facial expressions and body language. And for, I'm assuming most people listening are probably familiar with spoon theory, but if not, have a look. It's a wonderful explanation of resources and cognitive resources and energy resources. But if you've used all your spoons up simply getting to work that day, reading body language and facial expression deliberately and then trying to integrate it with what you're hearing, and infer the subtext and give an answer that's appropriately also high context communication is literally impossible. The good news is that if we can convince people to take the literal meaning of our words when we speak, everything gets a whole heap easier.
I have this fight so many times with my husband because, it'll be like, I joke about this scenario. We're going out to eat dinner and I just, I'm thinking and I've got 20 million things going on in my brain because that's the ADHD part. Or I'm like solving the world's problems and listening to music all at the same time, right? And I'll be like, where are we going again? And I just literally want to know if you're reminded where it is we're going. And he always, without fail, go, oh, did you not want Chinese? And I'm like, oh, we were going for Chinese. That's all I needed to know.
Yeah.
And then he goes into this like, well, what would you want instead? I was like, what are you talking? Like, did I say I didn't want that?
And that's the perfect example.
We've been together 20 years this year, but like that is a continued thing that we can always have because he's just really looking for the subtext that I'm like, I just don't give you, but you continue to look for
Right.
it.
Yeah. And it's just the way neuromajority brains have as a default style of communication, just like we have a default style of communication that's often very literal and low context. And in our household, my wife's the only person without an autism diagnosis out of there's 6 of us. So I have 3 adult daughters. I have a 7-year-old son who just this week has joined the Cool Kids Club and got the official ASD diagnosis. And he's very excited about that because we talk a lot about brains and brain styles and how if you have a neurodivergent brain, then we can start to understand our brains and ourselves better. And so he's quite a good self-advocate and will tell teachers when they ask him to do something that is challenging that brains are all different and some people's brains don't do well at some things. This is one of the things my brain doesn't do well. And I love that he has that level of self-advocacy as a little kid. And I'm really looking forward to seeing how he develops as both somebody who has a formal identification in early childhood and who lives in a neuro-affirming household where we're allowed to self-advocate, and we're allowed to unmask, and we're allowed to have needs that aren't considered normal for the rest of the world.
Oh, I love that. I have 2 boys and both of them are diagnosed ADHD. So I'm the only one in the house that we're aware of with the ASD diagnosis. And it's hard. I would say it's really hard being even late diagnosed and trying to understand my kids with no template or blueprint of what it's like to be a neuro-affirming parent and trying to be that for my kid. Like I find myself failing at it and trying again and failing at it and trying again. Like just because I revert right back and I hear it, like I'll say something and I'm like, that was totally what my parents used to say to me and I need to do better.
Yeah, so we've normalised positive failure in our house because it's the same for us. We're deliberately neuro-affirming and sometimes my mother's voice comes out of my mouth when I'm not paying attention. So as a positive failure practitioner, I acknowledge the mistake as soon as I made it. Whoa, Asher, I'm so sorry I shouted at you. That was really inappropriate. I didn't think before I spoke what I should have said. And I love that he started doing that too, that he's taking on that idea of positive failure and that we can learn from anything that doesn't go quite to plan or that we didn't mean to do, and we can change our approach for next time. Iteration is the love language of inclusion. That's one of my favourite inclusion ideas. And that means that we try and we get it wrong and we try again and we get it a little bit less wrong and we just keep going until, I think as far as being neuro-affirming goes, especially as a neuro-affirming parent, I think we just need to try. And our kids seeing us try and seeing us acknowledge mistakes when we don't get it right is a wonderful gift that we can give them.
Yeah, I always tell them, I'm going to fall on my sword. I totally messed this up. Can we try again?
Yep. And it's hard, right? Because we're used to being afraid of mistakes because that's what we've been conditioned to be.
Yeah, correct. Yeah, and I call it like Clash of the Titans. I call it Clash of the Neurodivergence. Like I have a hard time with, I am very noise and sound and light sensitive. And my kids are loud and my youngest will stim verbally and loudly and repetitively. And I just my skin crawls. I'm like, oh, the repetition of that just makes me want to crawl into my, inside my own body. And I have to like remind myself, I was like, okay, advocate for my needs without shaming him for his.
Right.
And like I have to continuously remind myself because my immediate reaction is like, stop that, go somewhere else and do
Uh-huh.
that. And so, although I fail
Yeah.
at times, I have to be like, okay, I need some sound sensitivity so I can either walk away or where else can you do that? Because I'm struggling right
Yeah, look,
now.
we have noise cancelling
And
headphones
it's
in
really
almost
hard.
every room of the house because I'm sensory avoidant and my son's sensory seeking. So same thing,
Yeah.
absolutely clash of sensory needs, particularly around noise. Unfortunately, we have a pinball machine in our house because my partner loves it and Asher loves it and I hate it with a passion. But we accommodate each other. If they want to play, I put the noise cancelling headphones in and understanding that it's okay to do things that are, I guess it's probably considered rude in most households to wander around with noise cancelling headphones in so someone has to tap you on the shoulder to get your attention just to, have a conversation with you. Except it's not rude when we talk about meeting needs and we explain what we're doing and why we're doing it and we normalise that self-care that's so important.
I love that. Have to bring this up because I've been fascinated by there's a story that you have around communication failure and being kidnapped, but I don't want to take it. I'd love to hear the story from you. I don't want to take too much away from it. Can you tell us the story of being kidnapped?
Yeah. So, I mean, there's a little bit of background I'll have to give you, but I think it's probably worthwhile. One of the things that came up in some of my more recent research has been the idea that we need to extend cultural humility beyond human healthcare settings to all interactions where there's a power imbalance. So cultural humility posits that everybody is the expert in their own life and experiences and that people with power in relationships have an obligation to take steps to share that power rather than using that power to get outcomes changed to suit them. And cultural humility arose from an idea called cultural competence, which was a complete failure and a bit of a disaster. And it arose in human healthcare settings as an idea that you had to become competent in your patient's culture so that you knew how to talk to them and what they needed. However, the idea that in the 5 minutes of, in the opening 5 minutes of a veterinary exam, can you become competent in the culture of the client? No, human doctors couldn't either. And so it was basically what happened was that the people sort of came up with some stereotyped idea of something around a culture that was vaguely similar to the patient's culture and applied that so that would do. And it was actually the opposite of inclusion. And I didn't really understand what had happened when I was kidnapped by Turkish sailors. I didn't understand that that was a problem of explicit communication and a lack of cultural humility. But it certainly brought it home when someone explained the idea of cultural humility to me. And what happened was that it was my first solo weekend on call in large animal practice in southwest Western Australia. Big port in the city. My boss had gone to Perth for the weekend because it was his first weekend off in like a million years. And I was doing the after hours. And I got a phone call from my boss that said, Port Authority have a goat for you to use today. Grab the bag and meet them down at the Port Authority office. And then he hung up and didn't give me a chance to ask any questions because he was one of the people who told me that I asked too many questions, so he avoided them at all costs. So I went and got my little kit, and I got the large animal kit because it was a goat, and I went down to the Port Authority office and I knocked on the door and it said closed and there was no one to be seen, but I heard someone shouting, come in from the back. So I wandered in and there were two people in there. One was an ancient sailor and you could tell back, this was in the 90s, so you could tell because he had like an anchor tattoo on his arm. And right, but only sailors used to have tattoos. And then there was a young fella who looked like he would be lucky to be a teenager. He had this giant mop of curly hair that covered his face, so I couldn't see his face. And as I walked in, I said, hi, I'm the vet. I'm here to euthanize a goat for you. And they handed me a life jacket. I was like, oh, no, thank you. Don't do boats. And they were like, the young fella said something and I just could not understand him. And at that stage, I thought I had hearing problems. I wasn't aware that auditory processing could be delayed. I thought I was going deaf. Turns out he was from Glasgow and speaking with a Glaswegian accent, so nobody could understand him. It wasn't just me. But the ancient sailor understood him and he said to me, oh, that's Colin. He's from Glasgow. and your patient is on a boat, so you have to put on the life jacket. And I was like, no, I don't do boats. And they were like, here, take the life jacket, and sort of pushed me out the door. And so we got on the pilot vessel and we started heading out through the harbour, and I'm like, okay, this is okay. It's a calm, quiet day. I wonder which of these boats has a goat on it. And then we went out of the harbour, headed straight out to the open ocean. And I'm like, where's the goat? And he said, oh, we've got to go out to international waters because you couldn't bring live hoof stock into Australia at that time, into Australian waters, had to be euthanized before it entered Australian waters. I'm like, how far out to sea? It's only going to be about 30 minutes, love, just relax. So I was like, and then I started vomiting over the side of the boat, and I vomited for the next 30 minutes. Towards the end of my vomitathon, we got to sort of see a smudge on the horizon that gradually resolved into a giant container ship. And I looked up at the side of the container ship and thought, I wonder how they're going to get the goat down to me from up there. Turns out they weren't. And so I got to climb 3 stories up a rope ladder onto the deck of this ship. And this was the 90s. Workplace health and safety wasn't actually a thing back then. So up I went, and at the top, standing all around the railing that I had to climb through to get on the deck, were a whole heap of big, smelly, hairy men. And I'm not a giant person. I was even smaller back then as a young person. And it was a little bit intimidating, but Colin came up behind me and I was like, oh, cool, someone's with me. It's fine. No one can understand him, but at least they'll understand me. And I said, oh, hi, I'm Jody. I'm the vet. I'm here to euthanize the goat. And they all looked at each other. And then one of them looked at me and went, oh, no English. And I was like, oh, cool. So Colin decided to communicate clearly for the first time in his entire life. And he pointed at a bloke who was walking over with something in his arms. And then he pointed at me, and then he ran his finger across his throat to indicate that I was going to kill something. Now, it turns out the thing the guy was carrying was a 2-week-old baby kid that had been born on the boat from the last go that they'd bought as food for the journey. And it had been hand-raised by them using a cloth soaked in milk to feed it. And they'd been taking turns sleeping with it at night to keep it warm. And as soon as Colin indicated that I was going to murder their pet, they got very, very angry. And some of them started shouting at us, and we're up against the rail, terrified. Some of them stormed off, and we're like, no, whoa, wait. The Port Authority says we have to do this. Don't blame me. No one understanding. And then we felt the ship's motor turn on and the ship started to move. And I looked at Colin, and Colin looked at me, and I went, I think we're being kidnapped by Turkish sailors. And Colin went, yep. And that was the only word I've ever heard from Colin that I understood. Anyway, the bloke who told us no English had run off as soon as the shouting started, and he came back on deck a little while later, seconds later probably, but it felt like several hours, with another man who was wearing his pyjamas and bare feet and looked like he'd just woken up. Turns out the bloke who just turned up in the PJs was the captain, and he'd been up all night battling, getting into port because it'd been really rough weather. And he said, what's happening? And I told him, and he spoke English, thank goodness. And so he went, give me a minute. He went and stopped the ship from going back to Turkey because apparently if I was going to kill their pet, we were all going to Turkey. And then he translated for me. And what was a really frightening group of aggressive people turned into a very sad group of quietly sobbing pet owners once that explanation happened. And we performed that euthanasia with as care as we ever did any euthanasia. And we were lucky that it was a good use because I'd grabbed a large animal bag and had to do IM sedation and a heart stick because I didn't have anything smaller than a 14-gauge catheter in the bag. But it went well. It was smooth. They were able to hold the goat while we euthanized it. It was, it was as good as it could be. But when I learnt about cultural humility and I knew more about explicit communication, I was like, they were the 2 things that were missing in that story. That explicit communication and cultural humility can make such a difference that if they'd been applied in that situation, I wouldn't have been kidnapped, however briefly, by Turkish sailors because I was killing their pet. And I think one of the things that I found really empowering and joyful about an adult diagnosis of autism and ADHD has been my ability to rewrite narratives that where I was the problem and I was the failure. And instead of me carrying that as, I don't know what I could have done, but I did bad, I was able to reframe it as, right, so what we needed in that situation was cultural humility and explicit communication. And nowadays, if I was going out to sea, I'd ask questions like, is there a native English speaker on the ship? If not, I'd need to take a translator. So, those little things that we carry with us as traumas or our own creation. I did bad, I did wrong. The problem can be rewritten in terms of the system set me up to fail, and knowing what I know now, I would do things differently. And forgiving our past selves for the mistakes we've made where we were always the problem,
Yes.
I think allows us to integrate neurodivergence into identity. And we know from the research that if we can integrate our whole selves into social identity, we are much happier people and we are much more likely to flourish in the world.
I love that reframing. I never really thought to look back at the stories because, I go through my own shame spirals of like, in the past, this happened. And I never really thought to reframe them as like, this is what I needed in the moment and didn't have. So I really love that idea of like revisiting those memories so that they're not as shameful.
Yeah. And it's
as they are
empowering
today.
to do that and to realize
Yeah.
that you weren't bad at what you were doing. You were under-resourced is like incredibly free.
Yeah. Oof. You're probably going to get a message from me. I'm like, this is really helpful.
Cool.
So as we sort of bring this episode to a close, I've got a couple last
Sure.
questions for you, which is, so the show is called Left Unattended. I'm curious, what does that invoke for you in the way of neurodivergence moves through the world or the workplace?
So it makes me think of being the overnight hospital vet in an emergency hospital where I got to go around and change all the things so that I got to dim the lights and I got to turn down volumes on drip pumps and I got to ask everyone to use their inside voices. And I got to disrupt the world to make it more comfortable for me in a way that didn't hurt anybody else. In fact, it was probably beneficial for everybody. But without being left unattended, I never would have got to play with that idea that small changes can make the world an easier place for me to exist. And I think that was my first, being left unattended was my first step towards disruption.
I love that so much. Oh, awesome. And my last question for you is, what would you want the world to know about your flavor of neurodivergent?
I think the most important thing for me and for every other neurodivergent person is if the world could understand that while most neuromajority brains are similar, every neurodivergent brain is different. And we know that autistic profiles are so heterogeneous that they are more individual than fingerprints. So the idea that you know one autistic person means you know one autistic person, and you still have to be open to difference and use curiosity to find out what people's needs are.
Oh, thank you so much for being here. I loved hearing your story. I think there's so much more I would love to dive into because you've opened some cracked doors into some insight I have right now. But thank you again for being here. I really loved having you on the show today.
Thank you so much, Ron. It was a pleasure to have a conversation.
Yes, absolutely. Till next time. Thank you so much for listening to this episode of Left Unattended. A huge thank you to my guest, Dr. Jody Wilson, for sharing her insights, her honesty, and her deep commitment to disrupting the systems that create barriers to true inclusion. And of course, thank you, Dustin Bays, for editing and making sure this podcast sounds as good as it feels. If today's conversation resonated with you, let's keep it going. Join my newsletter for weekly insights on neuro-inclusive leadership, and that's www.synapt.me/newsletter. That's syn-apt.me/newsletter. Learn more about coaching with me at coaching.synapt.me. And if you want to learn more about Jody's work, her research, and the conversations she's helping lead around neuroinclusion in veterinary medicine and beyond, we'll include her information in the show notes. Finally, if you enjoyed the episode, please follow the podcast and leave a review, please. It helps people find these conversations and reminds the world that belonging isn't a luxury, it's a leadership strategy. I'm your host, Ron Sosa, and this has been Left Unattended. Until next time.